out of that report to take you live to Geneva. That's the WHO head, Director General, speaking, holding a news conference. Let's listen in.
Has quite understandably paused its operations. I honor our colleagues for their service and for putting themselves in harm's way to serve others. WHO has been working with World Central Kitchen in Gaza to deliver food to health workers and patients in hospitals. This horrific incident highlights the extreme danger under which WHO colleagues and our partners are working and will continue to work. But we can only do so with safe access. This means an effective and transparent mechanism for deconfliction must be put in place to ensure humanitarian convoys can move safely. We need more entry points, including in northern Gaza, cleared roads, and predictable and expedited passage through checkpoints. Delays and denials of humanitarian missions not only prevent us from reaching those in need, but also impact other operations and deliveries by diverting scarce resources. In addition to the attack on World Central Kitchen convoy, we're likewise appalled that Shifa hospital has been put out of action and that much of it has been badly damaged or destroyed. Over the last few days, WHO's team in Gaza has been seeking permission to access what is left of the hospital, to speak with staff, and to see what can be saved. But at the moment, the situation looks disastrous. Shifa was the largest hospital and main referral center in the Gaza Strip, with 750 beds, 26 operating rooms, 32 intensive care rooms, a dialysis department, and a central laboratory. I repeat, hospitals must be respected and protected. They must not be used as battlefields. Since the conflict began, WHO has verified 906 attacks on healthcare in Gaza, the West Bank, Israel, and Lebanon, resulting in 736 deaths and 1,014 injuries. Only 10 of Gaza's 36 hospitals are still able to function, even partially. WHO will continue to support those hospitals to deliver services as best they can. More than 33,000 people have now been killed in Gaza and almost 80,000 injured. We're seeing a very high burden of respiratory and skin infections and diarrheal illness. This Sunday marks 6 months since the conflict began. WHO welcomes last week's UN Security Council resolution demanding a ceasefire, and we call for its immediate implementation. Once again, we call for all hostages to be released and for lasting peace. Now to the Democratic Republic of the Congo, which is experiencing a severe outbreak of Mpox. More than 4,500 suspected cases and almost 300 deaths have been reported so far this year, triple the numbers of cases and deaths reported in the first quarter of last year. 19 of DRC's 26 provinces have reported cases, and 70% of cases and 87% of deaths are in children under 15 years of age. While Mpox is spread among children by close contact, there is also a concerning outbreak among adults due to sexual transmission in previously unaffected areas. These outbreaks are being caused by clade 1 of the virus that causes Mpox, which has been present in DRC for decades and can cause higher mortality than the clade 2 virus that spread globally in 2022.
So that's the Director General of the World Health Organization, and he was just starting to speak on the conditions in the Democratic Republic of Congo. But before that, he did focus on the situation in Gaza, and he is appealing for safe access for humanitarian workers in the Gaza Strip. He's also appealing for access to checkpoints as well as land borders for more aid to get into the Gaza Strip. He said that the WHO as an organization has been seeking access to Shifa hospital, which, as you may recall, was raided by the Israeli forces and completely destroyed. It's been put out of action, according to the WHO chief. He also said that hospitals must be protected. This all coming after the Israeli military launched 3 consecutive airstrikes against the World Central Kitchen workers earlier this week, killing foreign nationals.